Case Study 1. You have been hired as a new graduate in an extended care facility with an interdisciplinary team approach. The patients are recovering from multiple healthcare problems that have reduced their ability to manage personal care in their homes. The stated mission of the facility is to provide needed rehabilitation for the patients. The informal purpose is to provide care for as long as the insurance plan will cover the care. Often the covered stay is over before the patient reaches maximum benefits, causing patients to use personal funds or be discharged to a nursing home. The customer satisfaction survey indicates declining quality of care. Morale is low, staff members are stressed, and fear being laid off. Communication among disciplines is poor, and administrative turnover is high. So, what are the differences between quality assurance and quality improvement? Should both be considered in the above scenario. So, when you look at, in this case, I think that they should consider using both quality assurance and quality improvement. They can use quality improvement by taking care of the problems that are currently going on, such as finding a solution to the poor morale. They could also focus on building better rapport with the staff members. Management can possibly consider having a meeting to talk about layoffs and how the facility is doing. I believe that communicating with the staff would reduce fear and stress. All of these things could help the staff feel safer and more secure. When the staff feels safer and more secure, they are more likely to provide better care to the patients. They can focus more on their patients, which may increase the quality of care. After proactively doing things every day, and when the staff sees opportunities for improvement, they can then use quality assurance to look at patients' discharge records. They can look at how morale is, turnover. They can also look at data and customer satisfaction surveys to see how well they've been doing and to see if they need to make any changes in the facility.
How does a mission statement guide team efforts? Is there evidence of team efforts towards fulfilling the mission statement in this situation? Mission statements are formal expressions stating the primary purpose of the practice unit, basically its reason for being. It describes what a unit is trying to accomplish. A mission statement guides team efforts by requiring all members of the unit or staff to participate in the mission statement. It is a guide of what the staff and participants should be accomplishing. In this case study, there is no evidence that the staff is trying to fulfill this mission statement. They are not providing quality care and rehabilitation for their patients. A barrier to fulfilling this mission statement is the fact that insurances will not cover care as long as most patients really need it. Therefore, the staff cannot take care of the patient effectively. This makes it quite impossible to completely fill this mission statement. Also, the morale is low. The staff does not have confidence or enthusiasm, which could also add to the decline in quality of care being provided, thus making the mission statement not able to be fulfilled. Once pertinent data is presented, what strategies could nurses and other team members use to establish realistic outcomes to evaluate patient care? The strategies that nurses and other team members use to establish realistic outcomes to evaluate patient care is by addressing the staffing issues. We need to find out what is causing the staff members to be stressed and causing such a high administrative turnover rate. If we can find a way to fix the morale of the staff, the quality of care will increase. We need to establish better ways to communicate amongst healthcare disciplines to prevent miscommunication and added stress amongst the staff.
You are a new graduate working in an acute care or orthopedic facility. Most of your patients follow care maps throughout their stay. Some elderly patients with multi-system dysfunction do not stabilize for discharge to either a subacute or home setting according to the MAPS guidelines. The staffing is usually 1 RN for 10 to 14 patients, with the LPN and unlicensed assistive personnel for assistance. Often you struggle to complete the tasks of care in your care maps. In addition, discharge preparations by RNs are frequently minimal. Define evidence-based care. Evidence-based care is recognized by all parts of the medical staff that care is based on a state-of-the-art science report. This process collects, reviews, interprets evaluated research for applying direct patient care. Using a model for improvement, how could the situation improve? This situation could be improved by increasing the staff, having a lower patient-to-nurse ratio, and delegating tasks to LPNs or UAPs. Describe how you would envision implementing the PDSA model. Implementing the PDSA model would require making a plan. Who will be responsible for doing what they will do, and where they will complete tasks. It could be as simple as writing tasks on a board or making a list for each member of the healthcare team on the floor. Do you believe that nurses working together with the healthcare team can make a difference in changing quality of care in real-life situations? Nurses can absolutely make a difference in changing the quality of care in actual hospitals. They have the most one-on-one time with the patients, so they will be able to assess if the plan of care is effective.
That is the end of our presentation covering quality improvement. Thank you for listening to our presentation.